Hi, my name's Haley Hudson, and today I will be presenting my paper for English 122. I'm currently a nursing student at Del Tech, and I'm halfway through the program. When I graduate next spring, I hope to become a postpartum nurse. My aspiration to go into this field of nursing inspired my research topic for this presentation. My topic is entitled Treatment versus Punishment: How to Respond to Women Who Use Opioids During Pregnancy. Prenatal opioid use has become a big issue in today's world, and as a postpartum nurse, I will unfortunately see this in the field. So, more than 5% of women use opioids during their pregnancy. This statistic just goes to show how prevalent this issue really is. One major consequence of opioid use during pregnancy is neonatal abstinence syndrome, or NAS. This condition primarily affects a newborn's central nervous system and autonomic nervous system. Hyperactivity of these body systems lead to symptoms such as difficulty feeding and calming, irritability, excessive vomiting and diarrhea, seizures, and problems with sleeping. There are also many risks associated with NAS. This includes fetal growth restriction, so the baby isn't growing at the proper rate. Also, a condition known as abrupto placentae, which is a premature separation of the placenta from the uterus. This can actually cause problems to the newborn. They're not getting the proper nutrients that they need in the womb, and it can also cause bleeding issues with the mother as well. And then it can also cause premature labor and then fetal death. Now, this chart here just further explains the intensity of NAS. For example, it says right here, every 25 minutes, a baby is born suffering from opiate withdrawal. And these other charts here show just the hospital expenses and then also the increase in hospital stay. One way that the United States has dealt with women who abuse opioids during their pregnancies is through punishment via the law. Some examples of punitive actions are: in 18 states, the use of opioids can lead to the termination of these pregnant women's parental rights. Also, in the state of Tennessee, opioid use during pregnancy is considered child abuse. Therefore, a woman can be criminally charged and possibly face incarceration for this choice. Now, according to the American Academy of Pediatrics, criminal charges against women who abuse drugs during their pregnancy have been proven unbeneficial to both the mother and newborn. And I'll tell you why. Many times the threat of criminal prosecution discourages these women to seek valuable prenatal health care and also consent to crucial prenatal drug screenings. Also, there is no correlation between criminal punishment and decreased rates of opioid use. And unfortunately, the pressure of punitive actions against these women tend to promote the idea of terminating their pregnancies. So punishing these women for their addiction is not the way to go. Now, treating their addiction is the best way to help women who abuse opioids during their pregnancies. This is done through medication-assisted therapy, or MAT programs. The two medications that are used for this type of treatment is methadone and buprenorphine. Methadone is known as a full agonist medication, which means its effects are much stronger and faster than others. The risks associated for this medication are respiratory depression and possible overdose. Now, because this medication has various dosage adjustments throughout treatment, its accessibility can be difficult for addicts. It is usually distributed to patients on a daily basis through an inpatient MAT program. On the other hand, buprenorphine is a partial agonist. So this means its effects are not as strong and fast-acting as methadone. So the risks of overdose is less likely. Additionally, this medication is more accessible than methadone. It is distributed through an office-based setting on an outpatient basis, and there are no daily visits to an MAT program for patients. Treating these women is definitely the way to help their addiction, but many improvements need to be made to the current treatment programs. First off, methadone is not covered by Medicaid in 20 states. Additionally, buprenorphine has many lifetime and quantity limitations. For example, right now in 11 states, buprenorphine prescriptions last no longer than 3 years. So how can a woman seek treatment for her addiction if the medications that she needs for success aren't even accessible to her? There are also a lack of programs specifically targeting pregnant women struggling with opioid use disorder. Only 19 states have drug treatment programs designed for pregnant women. The main issue with the treatment programs that are out there right now is the lack of accessibility towards pregnant women. Once this is changed, hopefully the prevalence of opioid use disorder in pregnant individuals will change. That concludes my presentation. These are my references for my presentation. Thank you for listening.